So think about where you live, where you work, how far away your doctor's office is. Believe it or not, these factors really do contribute to your overall health.
A center in Winston-Salem dedicates its time to researching those things and how they impact communities of color. Jordan Brown shows us how in this week's In Black and White. Good morning, Jordan.
Good morning. Statistics show that lower income communities of color are the most disadvantaged when it comes to healthcare access. Through advocacy and research, the Maya Angelou Center for Health Equity is working to change that. Researchers here in the Triad are trying to make sure groups of people who need healthcare the most are getting it. And if they're not, figuring out why.
Part of what we do here at the center is really doing research, working with communities, talking to people in the communities, understanding their concerns. What are their needs?
The Maya Angelou Center for Health Equity at the Wake Forest School of Medicine is devoted to learning the why behind large gaps in access to health care.
Many of the inequities that we see in healthcare and health are related to things that we call the social determinants of health. That's where you live, that's where you work, that's where you get your medical care, it's your environment. Many of those things have an effect on how healthy you can be.
Research the center has done shows these inequities in healthcare mostly impact lower income communities of color.
If you're working in an environment where even if you have access to health care, that it's too expensive for your income, or that even if you want to go to the doctor, well, you have to take 2 hours out of your day, but you're going to lose 2 hours of income. You can't afford to do it. So is it really access?
2019 data from the National Center for Health Statistics shows the life expectancy for Black people was 4 years lower than their white counterparts. It dropped even lower after the COVID-19 pandemic. Only 30% of these outcomes are due to genetics. The other 70% are a combination of environmental factors, individual behaviors, and lack of access to quality health care.
Prostate cancer is one. There is Alzheimer's disease, heart disease, diabetes, infant mortality. There are a number of conditions for which African Americans and American Indians are disproportionately affected negatively as compared to their white counterparts.
Decades of racism in healthcare, lack of diversity, and various stigmas have built distrust in these communities.
There is historical atrocities that have happened in research and in medicine that have affected various populations, particularly African Americans.
Step one is building back that trust in communities of color. Staff at the Maya Center does that by getting out into the community, going to events, handing out literature, and making sure people know they are there as a resource.
So we're actually doing some work now as well. We're looking at the genetics of Alzheimer's in African Americans. Yeah, we think that there may be some different reasons why we develop it more frequently.
And until these underserved communities are acknowledged, there can't be a permanent solution.
We sometimes hear people throw out equity and equality. So equality is when everyone gets the same thing. So, everyone gets the same amount of something. But that doesn't take into account the fact that some people may need more, or some people don't need as much of a particular thing.
Staff at the Maya Angelou Center say maintaining your health and wellness isn't just about going to the doctor regularly. Participating in research studies is just as important so that inequities can be documented and properly addressed.